Two of the pathologic conditions that can present with jaw pain include trigeminal neuralgia and temporal arteritis, and both of these conditions are high-yield topics that can be tested on Step 1 exam. So trigeminal neuralgia is a very painful condition that is caused by the vascular compression of the trigeminal nerve root. So the trigeminal nerve root is being compressed, as a consequence of which it causes a shooting pain that can affect the jaw, lips, gums, as well as any part of the maxillary or mandibular area. It's less common to see in the ophthalmic area, but again, trigeminal nerve does have a branch to the ophthalmic area, so it's possible to see patients who present with a shooting pain in the ophthalmic area. Indeed, I did have a patient who complained of shooting pain around the eyebrow. And so here is the question for you. What medication should you prescribe for patients who present with trigeminal neuralgia? And the answer to your question is carbamazepine. On the other hand, patients with temporal arteritis, also known as giant cell arteritis, present with inflammation of the medium and large sized vessels, as a consequence of which there is thickening of tunica media, which causes compression of the lumen. Other features that you will see on histology is present of giant cells, which gives the name giant cell arteritis to this condition. And then one other important feature is fragmentation of internal elastic lamina. Now, as for features of this disorder, patients present with headache and tenderness over temporal area. Due to the compression of the facial vessels, these patients can present with jaw pain if they're chewing food or if they're talking for too long. And then they can also present with amaurosis fugax. So amaurosis fugax, which is a transient loss of vision, and this is again due to decreased perfusion of ophthalmic artery. So once again, due to the inflammation of medium and large size vessels, since there is decreased perfusion of the facial muscles, these patients can present with jaw pain, as well as due to decreased perfusion of ophthalmic artery, they can present with transient vision loss. So if you have any suspicions that the patient have temporal arteritis, you will have to right away start treating the patient with high dose steroids to prevent blindness. So you will not wait for any lab values to confirm that the patient has temporal arteritis. You suspect with your clinical findings that the patient has temporal arteritis, right away proceed with the administration of high dose steroids in order to prevent blindness. Now, important lab findings that you will have to know for temporal arteritis includes elevated erythrocyte sedimentation rate, as well as elevated C-reactive protein. If you are not sure in a patient that they have temporal arteritis, then you can biopsy the temporal artery to confirm the diagnosis. And then finally, the other high-yield point about temporal arteritis is that 40% of these patients can present with polymyalgia rheumatica. Now, just to summarize these findings, patients with trigeminal neuralgia, which is due to the vascular compression of the trigeminal nerve, present with a shooting pain in the jaw, gums, lips, maxillary, as well as mandibular area that has kind of like a burning or electric shock-like quality to it. And basically, conditions that can trigger this shooting pain include, for instance, chewing, toothbrushing, or even a cold wind. And then for the treatment of trigeminal neuralgia, what medication can you use? The answer is carbamazepine. Can be used for the treatment of trigeminal neuralgia. In patients with temporal arteritis, also known as giant cell arteritis, on the other hand, which presents in patients with the age of 50 or older, these patients present with headache as well as tenderness over the scalp or the temporal artery. They present with a jaw pain that is exacerbated by chewing or talking due to intermittent claudication. So again, due to decreased perfusion of the muscles of the face, patients will develop claudication that presents with jaw or tongue pain while they are chewing or talking. They can also present with amaurosis fugax, where there is a transient vision loss due to the decreased perfusion of the ophthalmic artery. And this is a very grim sign, as a consequence of which you will have to right away proceed with prescription of high dose steroids. And in order to be more specific, you give IV methyl prednisolone. 40% of these patients present with polymyalgia rheumatica, and then there is elevated ESR and C reactive protein in these patients. So just to summarize these findings again, temporal arteritis, also known as giant cell arteritis, presents in patients 50 years of age or older, presents with headache and tenderness over temporal area, jaw pain due to intermittent claudication or visual impairment due to decreased perfusion of the ophthalmic artery. You will have to proceed with high-dose steroids, an example of which is IV methylprednisolone. 40% of these patients have myalgia rheumatica, and there is an elevated ESR and elevated C reactive protein in these patients. And so the other question that I have for you is that what other tests can you use to confirm the diagnosis of temporal arteritis? And the answer is temporal artery biopsy. And so the final question that I have for you is that what will you see on biopsy? And the answer is thickening of tunica media, present of giant cells in tunica media, and then finally fragmentation of the internal elastic lamina. And that concludes our discussion of the trigeminal neuralgia and temporal arteritis topics.